everyone, my name is Matt and I'm going to talk to you about antifungal medications. Have you ever had a rash that burns, itches, and just won't go away? Not sure where it came from? Not sure what to do about it? Well, chances are, like most people, you've had a fungal infection somewhere on your body. Fungal infections are common and are often treatable with the right medication. Fungal infections of the skin are known as mycoses. The actual fungi are parasites that live off dead organic matter. Infection can appear anywhere in the body, but typically in warm, moist areas of the skin, such as the armpits and the groin. Other types of fungi are yeast and mold. Yeast infections are common and treatable with different drugs. There are 5 types of infections that take place in different areas of the body. Systemic, which can be internal and affect the whole body. Single organ system infections can take place in a body organ like the lungs. Subcutaneous, which takes place in the deeper layers of the skin. Cutaneous infections occur on the skin. And superficial infections include the skin, nails, and hair. Candida, which is often involved in fungal infections, occurs in the flora found in the body when the flora has become overgrown. Dermatophytes are a group of 3 types of fungus that can cause infections. Dermatophytes cause your common tinea infections and infections from inhaling fungus from bird droppings. Now that you know a little more about fungal infections, let me discuss some common antifungal medications and which each can be used for. First of all, to treat a fungal infection, you have to figure out what type of fungus it is. You can do this 3 ways: skin scraping, skin culturing, and blood testing for systemic infections. When treating fungal infections, it is important to know 3 classes of drugs that are used. They are polyenes, imidazoles, and triazoles. Polyenes include Emberteraceum B or Fungazome. This drug has been used since the 50s and is effective against Candida, Cryptococcus, and histoplasm. Often used for systemic infections and can be administered intravenously. However, it is a very toxic drug and can cause hypotension. Another drug, natamycin, is also used to treat Candida. It can be applied as a cream. However, natamycin is poorly absorbed to the body when administered. Secondly, we have imidazoles. These drugs inhibit cytochrome P450, which is an enzymatic reaction in the liver. Martindale as an imidazole can be administered intravaginally and is a topical agent. It is commonly used for athlete's foot, ringworm, and yeast infections. The brand Monostat is often used to treat yeast infections. Clotrimazole is another imidazole that is used to treat Candida and dermatophyte infections such as athlete's foot, jock itch, and yeast infections. The brand Lotrimin is a topical agent that is commonly used to treat ringworm and jock itch. A third and last drug class used to treat fungal infections are triazoles. They are similar to imidazoles because they also inhibit cytochrome P450. Imidazole intraconazole is a triazole that is administered orally and is used to treat blastomycosis and histoplasmosis. Its brand name is Sporanox. Another triazole is fluconazole, which is sold under the brand name Diflucan. It is a topical agent in the form of a powder. It is used to treat Candida, Cryptococcus, and histoplasmosis. Fluconazole can cause cardiac arrhythmias and should be prescribed with caution. In conclusion, fungal infections are quite common, especially skin infections when dealing with an athletic population. It is important to recognize the causes of infections and what treatments are available. A greater understanding of the antifungal medications will help you decide what's the best treatment.